Hi, my name is Alexandra Lopez, and today we're going to be talking about infection control. In order to maintain a clean and sanitary environment at a hospital or medical setting, there are certain guidelines, protocols, and procedures that one must take in order to keep yourself and the patient safe and free from different infections. Some illnesses are transmitted through direct contact, while others are transmitted through droplet, bloodborne, or airborne. If you don't follow specific precautions that are designed for every individual patient, you are putting yourself, the patient, and family members at risk. Hand washing is the single most important precaution that one must take when helping to prevent the spread of germs and diseases in a medical setting. The two most concerning bloodborne illnesses within the hospital setting are HIV and hepatitis B. HIV affects the immune system, while hepatitis B affects the liver function. That is just one example of when we would need to use transmission-based precautions. Another example is when the patient has a transferable disease, such as when it's airborne. This means that the infectious particles can remain in the air for long periods of time and can attach itself to things like dust. Examples of airborne diseases are tuberculosis, chickenpox, and influenza. These patients must be placed in negative isolation rooms, and we must use specialized masks that filter the air that we are breathing. Droplet precautions must be taken for patients who can transmit diseases through saliva. Simple acts such as talking or even coughing can put people around them at risk. Examples of this would be meningitis, influenza, and strep throat. Negative pressure rooms are not necessary for these patients. However, we must enter the room with surgical masks to protect ourselves. Contact precautions must be used when a patient can spread their illness through anything that they have touched or come in contact with. It's extremely important that we take extra steps when dealing with these patients. We usually have to use special impermeable gowns and masks when entering these rooms. The cassettes must be lined with a plastic covering. Gloves will always be used no matter which kind of illness you're dealing with and no matter what kind of precaution you need to take. But sometimes with these patients, it's better to use double gloves. We must thoroughly disinfect and clean everything that we touch and come in contact with when dealing with these patients. However, we need to make sure that we don't recontaminate something after it's been cleaned. Examples of contact illnesses are certain fungi, bacteria, measles, and certain respiratory illnesses. Standard precautions are the typical rules that are mandatory when dealing with any kind of blood, body fluids, mucus, or skin. You must always assume that each patient is infected. This way, you're always protected no matter what. Standard-based precautions include washing your hands often, always wearing gloves, wearing protective equipment such as gowns and masks, making sure there are no needles that are not capped, and that biospills are always cleaned up accordingly. Asepsis pretty much means that we're trying to keep the area that we're working in free from the contamination of pathogens. Asepsis can be divided into medical and surgical. Medical asepsis is pretty much the steps that we take in order to reduce the amount of bacteria that is present. Even though we're not going to completely eliminate all the bacteria, we're providing a better environment for it. It's in order for it to not spread or continue to reproduce. It is important that we maintain cold temperatures in medical facilities or hospitals, as bacteria tends to reproduce and multiply with warmer temperatures. Surgical asepsis is the process of keeping the field sterile before, during, and after surgeries. Hospital staff and doctors are very serious about surgical asepsis as they want to make sure to keep the environment free from bacteria and germs as to not contaminate the patient. We should always use the disinfectants that the hospital provides before and after any procedure. We can also use sterilization or pasteurization methods in order to rid the area of infectious microbes and bacteria. Our bodies have its own natural defenses that try to fight off infections coming our way. Sweat, mucus, body fluids can also try to block these microbes and organisms from entering our bodies. Negative pressure rooms can prevent airborne transmission. These rooms have a lower pressure than normal, and this prevents the air from leaving that room into nearby areas. Examples of diseases that need to be placed in negative pressure rooms are tuberculosis, Ebola, and chickenpox. Positive pressure rooms are used to protect the patients with weakened immune systems. These rooms have to push the air out of the room as opposed to keeping them in. Examples of diseases that would require positive pressure rooms are HIV, cancer patients, or anyone who's had a current transplant. Remember, washing your hands is the simplest and most important way to keep germs from spreading. Here are the steps you should take for proper hand washing. First, you must let the water run through your hands. Next, it's time to add soap. Next, you will rub your hands together in a circular motion. Now you're going to let the water run down your hands. Make sure you dry your hands from elbow to fingertips, assuring that when you turn off the faucet or open any doors leaving the restroom, you are doing so with a paper towel as to not recontaminate your hands. In conclusion, there are many steps that medical facilities take in order to prevent possibly contracting any unwanted disease or illnesses. It's our responsibility as X-ray techs that we follow these procedures and protocols as to maintain a healthy environment for everyone.
Worldwide,